give you a hint, it's not something you look through. What do you think that might be used for? It kind of looks like a vase, flower vase, doesn't it?
Horn?
It's something having to do with the horn and listening. This is a stethoscope. The doctor would put this end against his ear, put this end against the patient's chest to hear their heartbeat, or hear if their chest is congested, or if they got kind of labored breathing and maybe there's some fluid in their lungs or something. That's your stethoscope. It's a very interesting time because there's some wonderful scientific discoveries being made. There's tremendous advances being made every few years. However, the doctors, they're still holding on some ideas and theories that go back hundreds and hundreds of years. For instance, doctors in the gold rush were still using the idea, a theory put together by the Greeks 500, 800,000 years earlier, that any sickness or disease your body had was because of the fluids in your body, and they were out of balance. And all the fluids in your body they put into 4 categories, which they called the 4 humors. The humors were blood, phlegm, yellow bile, which is vomit, and black bile, which is excreted from your kidneys. And pretty much all the medical treatments, even up to the gold rush, is based entirely on changing the fluid levels in your body. So if you come up to me and you've got some kind of illness or something's bothering you, the doctor will listen to your symptoms, and if he determines that that you are low of some of the fluids in your body, he might recommend bed rest to build you up, maybe particular medicines, or going to change your diet. Now, if he thinks you've got too much of certain fluids, he's going to give you something like a mercury pill, which is going to make you vomit violently for days. He's going to give you a very powerful laxative to scour out your digestive tract, or he's going to bleed you. Doctors believed you could have too much blood, you could have bad blood, and it could be congested in certain parts of your body. That's easy to fix. We're going to take some of that blood away, and your body's going to produce new blood, and it's going to make you feel better. And the theory of medicine that doctors were using at this time, being trained in the first half of the 1800s, this is called the heroic theory of medicine, which means the doctor is going to do something violently to your system. It's going to shock it back into bringing itself back into balance. Well, some of the treatments they were using, they caused as many problems as they were trying to fix. They weren't very popular, they were expensive, but that is the kind of medicine that doctors were trained to give people at that time. Now for bleeding, doctor had a whole bunch of different instruments specifically for bleeding. This is a knife called a fleam, and it's different sizes of blades. For cutting you could be cut different parts of your body wherever you think is going to help fix your problem. Maybe the wrist, back of your hands, arms, legs, maybe even your foreheads, maybe the corners of your eyes, maybe under your tongue. And this is a bleeding bowl. That's where he would put either your arm or foot or whatever part of your body. It's where you collect the blood. And if people were shy about being cut with the bleeding fleam, the doctor could attach leeches to you. And a leech is a little dark worm whose job it is to suck your blood. The very best leeches come from Europe. They're shipped all over the world, even during the gold rush. There are actually leech farms where they raised the leeches that could be shipped all over the world. And a lot of people preferred having leeches attached to you. And leech is a worm that sucks your blood. A lot of people preferred being leeched rather than being cut with a knife. There were advantages to it. If a doctor cuts you with a knife, he might put your hand in the bleeding bowl and he might go off to do errands. Whereas he might not be paying attention to how much blood he is removing from you. Whereas a leech will take a certain amount of blood. A leech will drink about a fluid ounce of blood before he gets full and drops off your body. And one of the things about doctors in the mid-1800s is we don't really know how much blood's in the human body. We thought there's twice as much as there really is. So doctors thought nothing of taking a couple of pints at a time. I heard of a story about a doctor taking a quart from a patient. So here's another place where a leech has an advantage. You can put a number of leeches on somebody. You can put anywhere from 2, 3, 10, 20 leeches on a patient too. Now, of course, all people during the gold rush, they're out hunting for their own food. So people are carrying firearms. Sometimes they're not careful with them. Maybe they don't maintain them as well as they should. So most of the bullet wounds we see, they're accidental shootings, and a lot of people shoot themselves. So if somebody came to me and he had a bullet wound in his arm, he'd been shot in the arm, and we need to remove the bullet, first of all we got to find it. We're going to start off by using a tourniquet. And this is a belt that wraps around your arm. This is going to tighten up, and that's going to stop the blood flowing. It's going to stop you from bleeding. So a doctor can work on it. The doctor then has to locate where the bullet is so he can go dig it out. He would use this delicate little instrument here. That's a bullet probe. That's what he would dig around in the wound, try and find out exactly where the bullet was. But you know, a lot of doctors really didn't like using bullet probes. They much preferred using their fingers. And the doctors during the gold rush, they didn't know to wash their hands. And they didn't. Didn't know anything about germs. That didn't come up till 30 years later. So the doctor would reach around in there, find where that bullet is. Okay, now he'd get ready to remove the bullet. He would use one of his surgical knives, very, very sharp. He would cut that wound open even farther. His assistant would use these retractors.
Oh, wonderful.
To hold the wound open, because he has to go in and get the bullet out and any pieces of clothing or anything else that went in to the wound along with the... I know I should step back a few steps.
Where's the whiskey come in for the
We haven't even gotten to the worst instruments yet. Okay, so he's located the bullet, he's got the wound open, now he's going in after the bullet with these. These are ball forceps. And look how this has a little dimple, which will help it get a hold of the ball. Because after all, when he's reaching down there in the wound, it's bloody and slippery and kind of oozy. Down there, pulls that out. He's got the ball out. He's going to bandage up the wound and hope that it heals properly. Well, if it gets infected, or if it gets very infected, or if when he was shot in the first place, if that bullet hit the bone and shattered the bone, Dr. Goldrush can't fix that. What would happen if you get a very bad infection that you can't cure and doesn't get better? It eventually turns your blood to poison. And that poison is going to do this. It's going to kill you. So at that point, the only way the doctor can save a person's life is to do this. It is to take off the place where the poison is coming from in your body. And I'll tell you how he did that. So I've got the equipment here to do that. He used to amputate the arm. So you start off, once again, with the tourniquet that goes around your arm up here, very, very tight, so the blood's not flowing. Next he uses this knife. That is specifically an amputation knife. He cuts around like this, and he leaves a flap of skin like this, which is later going to be used to close the wound. For a big bone like an arm or leg, he would use his capital saw, the big saw. The bone is sawed. He would quickly use a file to run around the outside edge to round it a little bit so it's not so sharp. He has to stop the veins from bleeding, and he would have cut himself a little pile of little strings and threads like this, and he would take those up. He would use this tenaculum, pull out the ends of the big veins, tie them off with a knot and a string. The smaller veins, he had another one of these, had a little metal ball that he had heated over a fire, and he would burn closed the end of the other veins. Thyroid amputation in 2 minutes or less.
Oh my God.
And there was a surgeon in the 1830s that amputated a leg in London in 30 seconds. Of course, he was so busy trying to set a record, he cut off 2 of his assistants' fingers in the process. But they did it as quickly as they could to hold down on shock to the system and blood loss. Before, as I said, in the 1840s and 50s, they were just starting to perfect chloroform. And this was one of the many huge hurdles they were passing in the development of medicine in the middle 1800s. A number of tremendous things were happening right in the middle of the 1800s. As they perfected chloroform and ether, which was something you give people, it's a gas that they breathe, and it puts people to sleep so you can perform surgery on it. It kind of makes them unconscious.
How long did it put them to sleep for?
Depended how it was applied and for how long. And it was actually it's extremely dangerous, and in the 10 years it took to properly learn the dosage, about 1,000 people died with chloroform, because it was very easy to overdose. And it's a very, very powerful gas. It's also volatile, which means you've got to keep it away from flames. And a lot of these doctors were performing surgery indoors by candlelight. Fumes were known to ignite. The doctors and the assistants were known to pass out from the fumes. So doctors, it was very popular to perform surgery outdoors when you were using chloroform and ether.
And so if you're knocked out from chloroform or ether, you don't feel anything?
Not until you come out of it.
Okay.
You know, some of these
You start on whiskey.
Yeah.
it's something that completely puts you to sleep. But as you can imagine, before they had chloroform and ether, pretty much all you could give people was painkillers. They had powerful painkillers, but they're only going to go so far.
They had painkillers?
They had opium. Opium has been around for about 1,500 years. And derivatives of opium are morphine, laudanum, and paregoric. And you know, you could buy any of these things over the counter. Anybody could.
Those were the good old days.
So, as I was saying, one of the tremendous advances to then getting something like chloroform and ether, which would put you to sleep, they could do surgery. For the very first time, doctors could start doing longer surgeries. They could perfect their techniques. They could start sharing the information with other doctors. Prior to that, first of all, they didn't like doing surgery. If they did it as quickly as they could. In and out, fast.